So hi everyone, and thank you for joining us today. You are all, I am not, on Acalabrutinib or have been on Acalabrutinib as a treatment. And we're getting a lot of inquiries from CLL support members who are potentially going to be coming onto this treatment path in the near future and would like to know, your experience of it. So I'm just going to invite you to say a little bit about yourself in terms of when you were diagnosed and so
on. My name's Alice. I was diagnosed when I was 66. I found a little lump at the side of my neck. Went along to see my GP and he said he didn't think it was anything to worry about. We'll do some blood tests. And that was the first lot of blood tests I'd had probably for about 6 years. So they arranged these blood tests, and from start to finish, within 3 weeks, I saw a haematologist, and she said, you haven't got myeloma. And I thought, good, brilliant. She said, but, and I thought, well, there's always a but, isn't there? Here comes the but. And she said, you have got something called chronic lymphocytic leukemia. Now, I didn't hear those first 2 words. All I heard was leukemia.
I was diagnosed with CLL in August 2014 as a result of a regular blood test to check my cholesterol. A bit like Alice, the main word you hear of the 3 is leukemia. So what happened then in July 20 with what was called massive autoimmune hemolysis, it's sometimes known as AIHA. And they were going to put me on a general ward with 6 other people who, as you'd expect in hospital, weren't very well. And with all the COVID stuff going on at the time, it was something I didn't fancy at all. So against their medical advice, I just discharged myself before I really got properly admitted. I didn't realize at the time how ill I was, and that potentially I could become very ill and have a very bad outcome. And by October, my dosage of steroids had reduced gradually over time. And by October, I was feeling much better. And by January, I was officially back on watch and wait. But then by April, my this is April of 21, my white cell count rose quite a lot. And she was very concerned that I might get another bout of AIHA and therefore recommended that we start treatment. Just before that, Acala had been authorized by NICE for first-line treatment. So I've now been on Acala since April 21, I guess is 8 or 9 months. I asked Alice about whether her white cell count had gone up immediately after taking it. Mine did, and I understand that that's quite a common reaction. But alongside that, my hemoglobin has gone up, and it's now just inside the normal range at about 129, 130. I also have been taking aciclovir and the cotrioxamol, and I was on allopurinol to start with, but I think after about 3 or 4 months, I came off the allopurinol, which I was quite happy to do. It's not a very nice drug, I didn't think.
After being poorly for nearly 2 years, have multiple different things going wrong. I was finally diagnosed in April 2008. I was just 40 then. I was given a prognosis of 7 years to live, and that I needed to start treatment straight away. Fortunately, I didn't have treatment straight away. So after all the ICSI, my blood started to change because I started to get better. Or my blood started to improve because they were taking my bloods every week because they wanted to see what cocktail mix I needed to have. And with that gave me that reprise of being able to ask more questions. And I also wanted a second opinion and asked to be transferred to a research hospital. It was in autumn 2019, so that was 14 years later, I managed to hang on to not have treatment and still be alive after a 7 years prognosis. I needed treatment, and quite quickly. Because they say the younger we are, you can quickly fall off the cliff edge. what I didn't want, and I kept being offered locally, was FCR. Now, with IGVH unmutated, you cannot have FCR. It does not work. But that's what was being offered to me. I then finally got the accepted in February 2020. And then I started that treatment on the 5th of March. And then within a couple of months, COVID hit. So I had to go to the hospital 5 times a day. Have bloods checked, and we have like CT scans, bone marrow aspirates, and ultrasounds through that whole time. So that was really tiring, because they didn't want you in hospital. Within a week from cycle 1, I wasn't breathless. So I was breathless, fatigue. I'd got so bad before my treatment, I was literally struggling to put one foot in front of the other. I've managed to come off the morphine patches purely because I've started sea swimming. And that cold seems to be keeping my joint pain and inflammation intact. But if someone had said to me in the summer that I'd be going into the sea when our temperature was -4, I would have said they're barking mad, absolutely barking mad. I don't go in the sea in the summer, but I'm doing that every day because it is maintaining the joint pain, and it just makes me feel fantastic.
I had a blood test in 2012 after an infection and wasn't getting better. So I thought, oh, I've got post-viral fatigue. And the consultant said, you've got something called CLL. Well, and he gave me a booklet. Yeah. Well, I went home with the booklet and filed it, because I'm good at filing. In 2017, similar thing, blood test, it's showing CLL. I did get referred to the haematologist. Before he started any treatment, he wanted the GP to eliminate other causes, possible causes of fatigue. That was my main symptom. The consultant said it must be due to the CLL. Therefore, this could be the moment we start treatment. Anyway, I was allowed Acalabrutinib on compassionate use. In September, I definitely felt I turned a corner. However, my neutrophils were 0.8. I stopped Acalabrutinib and I had filograstim. Well, I did feel a bit weird on those, but they certainly brought the neutrophils back into play. Well, they shot up to 23. Went back on Acalabrutinib, only half the dose. The consultant was pleased. I mean, at the very beginning, he said I seemed to tolerate it well, which seemed to be the phrase they used. I don't seem to have any stamina. If I managed to do anything for 2 hours, I have to sit down and recover. But again, I put that down partly to age. I mean, I was 68 when I was first diagnosed. I'm going to be 78 in March. Did I really say that?
As CLLers, we get used to a level of fatigue that is possibly more significant than the general population. But I think when that fatigue level then changes, that usually, to my experience, that's a time then when it's worth talking to either the CNS or the consultant, even if you haven't got an appointment due, because something's changing.
When I was first diagnosed, that was my biggest problem. And also I was being told by my consultants it was nothing to do with the CLL. So I had a battle to say it must be. I'm Tania Vortex, you know, I used to run every day, I used to go to gyms, I used to go on trekking holidays. I was very, very fit and healthy to the point I could really just was struggling to do anything. I then got sent to a psychologist and had a report that thick done to say I wasn't depressed and this was part of my illness. And it wasn't until I saw a report done from Quality of Life by Monica Elsey for cancer research that fatigue was the biggest side effect.
When I started on Acalabrutinib, every time I saw the consultant, his main question about side effects was about whether I'd got any palpitations or whether I got any unusual bleeding.
But between 12 and 24, I got absolutely covered in bruising, really covered in bruising. And I sort of said, oh, something's not right. And all pin blood spots as well. That's one of the side effects on the Acalabrutinib. I don't know if anybody else has those. It's like little blood spots and bruising. But then for the last majority of my treatment, the last part, I didn't get any bruising. And then suddenly between post 12 and 24, actually absolutely covered in bruising.
Yes, I noticed that I had a rather loud heartbeat, like just in the evenings. And when I was quiet, when I'd gone to bed, when I was just lying in bed, I could hear my heart beating quite loudly. And I mentioned that to Dr. Monroe, and she just said, it's quite possible that is the anemia causing that. And she said, once we get the anemia under control, then you'll probably find that goes away. And it has. That's gone. I mean, I would just be delighted if I could have an immune system which was working.
Wouldn't we all? Wouldn't we all?
I mean, after three COVID jabs, I've just still not got any immunity at all.
In the middle of my having these filgrastim injections, I was due my third COVID. And I had the most severe reaction you could imagine. Well, who knows? I had the GP agreed to me having the flu jab and the third COVID on the same day in different arms. So when I had the reaction, was it having the two at once? Was it the CLL? Was it the fact that it was a Pfizer and I had 2 AstraZenecas? I mean, who knows?
When I switched from ibrutinib into venetoclax last year, and I had to have 6 cycles of rituximab, which corresponded with the injections for COVID and whatever. And I was very carefully advised to time my COVID injections with the rituximab cycle. So the rituximab cycle is on a 28-day cycle. I was fully ramped up with venetoclax, and then so I had to wait until just before the next rituximab was due before having a COVID or a flu vac.
So my decision making to go for Acala, because a 12-month treatment and then you're okay for a good period of time is quite attractive.
For me, that was a real key decision maker. I don't like taking drugs. She has been on a clinical drug trial. But that was, I didn't want to be on, and I liked that shortness of having that period when I could look, and then obviously you're still being monitored, which was really good. But that was why my favourism, I didn't want the side effects. And I knew that was the best BTK inhibitor out there at the time.
I think that's one of the advantages of watch and wait. With tumour cancers, it's basically, we need to do this or you're dead. So this is what we're doing to you. You don't ask any questions because you're still in shock. But like Tania says, with watch and wait, it gives you that time to, read some papers, find out what information sources, whether it's Mcmahon or cancer research or CLL support, leukemia care, whatever. Find the sources of information that you trust. And then go from there. If I hadn't found out about Acala at the time, in 2020, in 2020, that there was a second generation of BTK inhibitors and why it was and what it was looking to do, my consultant didn't know about it. I was, in that instance, I was actually leading my consultant towards that.
We produced a website called Support Act.
Oh,
no, I haven't seen that.
Which is about well-being. So it's about, if you are feeling a bit down about your CLL, here are some steps that you might take.
No, I avoid anything that says well-being or mindfulness.
But we all need a bit of a nudge sometimes, Kevin.
Can I say?
I'm not saying I'm right, just me.
One of my consultants, she was Sri Lankan, she said to me, even though I was into a real fitness bunny when I first got diagnosed, she said to me, the patients that do yoga, mindfulness, and don't eat red meat, look very much at your diet, do far better than those that don't. And I took that on board. And I think being given a diagnosis of 7 years to then not having to have treatment for 14 years, that helped me.
Right.
At the point now, I'm qualifying to be a yoga teacher so that I can then go on and be advanced to help people with cancer.
Well, I'd just like to say how grateful I am to have been on this little round table, because it's the first time really I've had a chance to talk in depth about it. I mean, I've got 2 children, 40 and 43, and you know, they're very sympathetic, but they don't really know quite what you're on about. I mean, they don't turn around and say, but you don't look ill, Mum. They don't do that because they've seen how my energy levels have plummeted, and they're quite willing to accept what I say, but it is different talking to people who really do know where you're coming from.
When we finally get back to conferences, you know, God willing and all that sort of thing, then you get a chance, Felicity, to meet fellow travellers and to have a real conversation about what's going on in your life and, you know, understand. Thank you very much indeed, everyone.
Thank you.
It's been a great conversation. Thanks.
Thank you all.
Thank you.
Thanks.
Thank you. Bye.